Hello, hello, hello. Tiffany Robinson here from Beyondrcm Revenue Cycle Management here in the state of New York. And thank you so much for tuning in to our discussion today. I have a really cool topic that we're going to delve into. But before we jump into that, I want to do some housekeeping and just first and foremost, welcome everyone who's tuning in today. To those of you who are regular listeners, it's always a pleasure, and I just want to say thank you for supporting our channel. And if this is your first time tuning in, Beyondrcm is a YouTube channel that is geared towards new or aspiring medical billers and coders, and we cover a wide variety of topics. We cover topics from starting out in the industry and the things that you need to know to be successful, to even more broader topics that are geared towards middle to senior management that relate to revenue cycle management and the evolving topics within the industry. So whether you're a newbie starting out for the first time, you've been doing this for a couple years, or you're a seasoned vet, I believe that the topics that we discuss on this channel will be relevant to everyone. And if you haven't done so already, please do not forget to like, subscribe, and hit that notification bell so that every time we put out new content, you will be the first to know. So I was supposed to be putting out a video this time that would delve deeper into my certification journey, but there is a very important topic that recently came out throughout the industry in various states, and I thought that it was very important for me to convey that information in this video. I can always put out a video about my certification experience. I think that this is more relevant to what's happening in the industry. So in our previous video, we talked about the fact that the PHE, the public health emergency, is scheduled to come to an end in May. And although there have been certain provisions put in place to extend certain services like telehealth through December 2024, there's one particular service that every medical provider, every healthcare worker, every MBC should be paying attention to. And this relates to Medicaid coverage and Medicaid managed care coverage, which typically fall under the category of HMOs. So with the end of the PHE, what we are learning is that the provision that was put in place for Medicaid recipients called continuous enrollment is also going to be coming to an end. Now, unlike telehealth services, which will be extended through December 2024, the continuous enrollment provision that was put in place for Medicaid recipients, that's going to be coming to an end at the end of June of this year. So what is continuous enrollment? So once the pandemic hit in the United States of America, there were a lot of things put in place to help patients get access to care. And one thing that was put in place was that coverage for individuals who didn't have medical coverage was provided to them through Medicaid. Okay. Now, Medicaid is regulated on the state level, which means that each state controls how they roll out their Medicaid coverage to their population. However, with the pandemic, what the federal government did is the federal government provided provisions that made it available for all states to offer Medicaid to their population, and they helped fund the program, right? So with the end of the PHE set to take place literally in, I think, less than 2 weeks, shortly after that, the federal government will also be putting an end to the provision that allowed continuous Medicaid enrollment. Continuous Medicaid enrollment basically meant that patients were approved for Medicaid with way less barriers. Now, typically, Medicaid is given to patients based on their income, and it's usually patients who have a lower income that qualify for Medicaid. So under the continuous enrollment provision, a lot more patients were able to access Medicaid coverage regardless to their income. And normally, in normal settings, when Medicaid is given to a patient, they typically have to recertify yearly on a specific anniversary date. So with this continuous enrollment provision, that was no longer a requirement. patients were automatically recertified for Medicaid without having to provide proof of income to their local Department of Social Services or Medicaid offices. So now that the Biden administration has announced that they're ending the public health emergency, and now that we're also learning that they're going to end the provision that provided continuous enrollment, what we anticipate is that across all 50 states, regardless to where you live, there will be a mass decline in Medicaid eligibility. There'll be a mass decline for two reasons. The primary reason is going to be because a lot of the patients who qualified under continuous enrollment and weren't subjected to providing proof of income will now need to provide proof of income. And then based on that proof of income, they will likely no longer qualify for Medicaid insurance. So that will automatically disqualify them. The other factor that we're anticipating is oftentimes patients move around from place to place to place. And in my experience, Medicaid is usually one of the last people to know that a patient has moved. So we anticipate that patients are going to be dropped because of income and then also because of failure to recertify. Now, there's an important caveat to the end of this continuing enrollment that patients need to be mindful of. Medicaid anniversaries are annual, and it's based on a specific month of the year. So any patient who had a Medicaid recertification date that's prior to June 30th of this year, they will automatically have their Medicaid renewed for an additional year because any service date prior to June 30th will still fall under the continuous enrollment provision. Patients who have a recertification date on or after June 30th, these patients will need to revert back to the guidelines specified by their state for recertification. So whatever the protocol was prior to the pandemic, you will revert back to that protocol to recertify for your Medicaid. So I want to encourage anyone, even if you're not working in the medical industry and you just happen to stumble across this video and you are a Medicaid recipient, it's very important that you know your recertification date and know where you stand in terms of recertification, because this is going to affect virtually every Medicaid recipient, every patient who has a Medicaid managed care plan. And when we talk about Medicaid managed care plans, we're talking about Essential Plan members, we're talking about Child Health Plus members, we're talking about HARP members, and we're talking about MLTC members, managed long-term care patients. All of these different product types, including managed care plans, fall under this new guideline that's set to come to an end. Now, from a practice perspective, what can you do to be proactive about the end of continuous enrollment? Well, I want to encourage you to do two things, because you may be saying to yourself, well, my office doesn't see straight Medicaid patients, so this doesn't affect me. That is a wrong approach. It absolutely does affect you if you take Medicaid managed care. So you may not take straight Medicaid in your office, but you may take a managed care plan such as Health First or Fidelis or United Healthcare Medicaid. If your providers are participating in these plans, then the end of continuous enrollment will affect you because these plans are predicated on a patient being Medicaid eligible. So my advice is make sure that you're not only checking eligibility on the managed care plan portal, but also make sure that you have access to your local Medicaid online portal. So here in New York State, our portal for New York State Medicaid is ePaces. So you need to make sure that you not only have online access to your HMOs, but you have ePaces access. Why is that so important? Because sometimes the managed care portal doesn't update as quickly as the Medicaid, the state portal. So you should be checking your eligibility not only on the managed care portal, but on the state portal for whatever plan regulates Medicaid in your state. So again, here in New York, our portal is ePaces. In California, for example, they have Medi-Cal and they have their own portal. So, and I believe it's the PAVE portal. I could be getting the names mixed up. But make sure you have access to your HMOs and make sure you have access to your state portal. You will need to have your patient's Medicaid ID number. And oftentimes that differs from the managed care plan member ID. A quick tip to work around that is you can always go on the managed care website, use whatever assigned ID they have, and then when you run eligibility, they will usually list the Medicaid number within that portal. You'll want to have that number, and you'll want to check eligibility in two places as of July 1st. You'll want to check on the HMO portal and on the Medicaid portal. If the HMO portal shows that the patient has active coverage on July 1st, but the state portal shows that that patient has been dropped, that patient has likely been dropped from Medicaid and is no longer Medicaid eligible. It's just that the managed care plan has not yet updated their system to reflect that change. So that is why it becomes extremely important that you have access to both platforms. We're putting this video out as quickly as possible to advise everyone to start having conversations in your practices about how you're going to approach this. Do not think for 1 second because you don't take straight Medicaid patients that it won't affect you. The only way it's not going to affect you is if you don't take HMOs at all. If you take HMOs, it'll affect you. So my advice, I'm so passionate, like my hair is flying all over the place. So my advice is please start having conversations within your practice about this crucial change that is set to take place, and formulate a plan so that you are proactively monitoring these changes. If you have a large managed care population, I would even recommend to start educating your patients now on the fact that they need to check their eligibility for Medicaid, because the continuous enrollment provision is set to come to an end and it will likely affect their coverage. And that is pretty much the RCM roundup that I have for you guys today. Obviously, this was more important than me talking about taking my test online and what that was like, but I promise I will put a video out on that very shortly. But I think that my community, that this is what they wanted to hear. They want to go back and start talking about this in their practices. So if you found this video helpful, I want to encourage you to please don't forget to just look at the video. You want to like the video, you want to subscribe, you want to hit the notification bell, you want to show us some love and recommend your colleagues to check out this channel. And if there are any topics that you would like us to discuss in the future, drop us a comment. We always are looking in the comments and seeing what your questions are and putting out responses. So thank you so much for taking the time to watch this video today. Again, my name is Tiffany Robinson. I have the privilege of being the owner of this amazing organization that just has a passion for mentoring and sharing information relevant to the field. So thank you for taking 13 minutes out of your day to hang out with us. I will see you really soon with another relevant topic pertaining to this dynamic industry that we call healthcare. Thank you. Be well. Talk to you soon. Peace out.